bench, a low box. This can even be done from the floor. And then likely a low to, like a red band, which is going to be like a low to moderate intensity band. So there's going to be a setup here where we're working on some rotation of the tibia in relationship to the femur. So using a closed loop red band, you're going to place both loops under the arch of your foot and then choke that band around the foot away from the body, okay? So it's running that direction. And then what we're gonna do here is we're going to do what's called a grapevine and wrap the band around the leg once or twice, doesn't need to be a lot. We just need tension so that there's no slack. And so the band is traveling this direction. You can kind of see the directionality based on the band, and I'm holding here. And this is giving, the band is pulling into external rotation of our shin bone. So what we're gonna be working on here is you're gonna raise your foot up off the floor just a little bit, and you're gonna be giving yourself some resistance. So you're actively trying to pull this band like deeper into rotation. We need to be careful that this femur doesn't fall open. We wanna keep everything stacked. So what we're going to be working on here is allowing our tibia, our shin bone, to kind of get pulled along with the resistance band. So it's getting pulled this way, and then we're going to rotate internally as much as we can against that resistance band. So this movement right here, where it kind of goes with the tension, is an eccentric, and then this movement here is our internal rotation concentric. And you can play around with how much knee flexion you have. And we want to focus on really getting the rotation to come from here and not from the foot. Not to say that the foot won't kind of move along with us, but we want to make sure that this is actually rotating and you can see the bands moving, and it's not just the foot moving back and forth. So letting the band pull deeper into external rotation and then pulling here. And where you want to feel this, the tissues that are actually doing the pushing and the pulling are this like high calf stuff here on the both medial and lateral sides, and then lateral and medial hamstring. So when I rotate inward, I can feel contractions here and I can feel contractions here. And when I rotate outward externally, I'm feeling effort and contractions here and effort and contractions here.